Now let's take this discussion further. We joined via Zoom by Professor Adrian Puren, who is the head of department at the Center for HIV and STIs at the National Institute for Communicable Diseases. Thank you very much for joining us. I mean, it looked like a stop-start from the beginning, where there was all excitement that the vaccine was here and it had to be stopped, and there was now panic as to what was going to happen next. And here we are today. So if it has kick-started like this, does it mean there is hope?
Absolutely. Developing a vaccine that will work is a high-risk venture. And so I know we were all very disappointed when the results from the AstraZeneca trial was announced. But there are other vaccines available. Unfortunately, the J&J vaccine has been stepped into the breach. And so I think it is really a good day for us all here to know that there is a vaccine that can be rolled out, because it's a vaccine that is effective, and that we can see that this plan can now be rolled out. So I think it's a good start, despite the initial concerns that we had about AstraZeneca.
Surely now you can refer to it as a confidence booster, especially seeing the president and the health minister doing the public display of them trusting that they take the vaccine in front of the whole nation watching. And what comes to mind is, what happened to the debate about the vaccine itself?
Are you referring to the AstraZeneca vaccine?
Yeah.
Yeah. So with regard to the AstraZeneca, I think the Minister of Health announced yesterday is that they will try and see where there is a need for this particular vaccine, the AstraZeneca vaccine, through the African Union, because again, not all countries may have been affected as we were here in South Africa with regard to that particular lineage or variant, and so I think the efforts will then be made to see whether or not there are other countries where this variant may not be present, to actually utilize that particular vaccine. As you know, even in the UK, the AstraZeneca vaccine is being rolled out as well, and I'm sure in other countries as well, it will be rolled out, provided that they don't have the same level of problem that we had experienced. So yes, that I think is the future for that particular vaccine.
And more so that this vaccine, the Johnson & Johnson one, is just only one dose. Then do we have enough stock to now at least, reach that stage whereby 65% of the population has been vaccinated, and there can be confidence that, in the other subsequent phases, there would be total vaccination of the country? And if so, then one can forget about the third wave as well.
Well, I'm not sure that we can forget about the third wave. I think just we need to be cautious, because remember, we're rolling this out in a phased way, and we will only reach a particular proportion of individuals in terms of the vaccine that we're currently receiving. There will, I think, be other vaccines becoming available based on what the Minister of Health has stated. For example, access not only to J&J, but also to Pfizer, for example. So in terms of reaching our goal in terms of a so-called community immunity or herd immunity, that will take a while till, I suppose, the end of this year, if not beyond that, to reach that. So I think we still need to be cautious about the fact that we still have vulnerable people that can become infected, and therefore all those non-pharmaceutical interventions that we've been harping on for more than a year now, or just close to a year now, still have to be in place. So I think we cannot let our guard down. I think it's really central that we still keep on with the wearing of the mask, the physical distancing, hand hygiene. All those particular factors are still, unfortunately, really key for us to continue while the vaccine is being rolled out.
You said we should be cautious. So I believe that politicians usually use the phrase cautiously optimistic. But then what should we be looking out for when we have to be sensitive to the fact that anything can happen on the downside, when we were excited that the vaccine is here and things will look good?
Yeah, so I think we have a vaccine. It's been shown to be efficacious, and in terms of moderate to mild disease, as well as the fact that more severe disease can also be prevented by this. So I think those are really important. And so I think the tools to measure those particular aspects are really going to be critical for us to really show that in the ideal situation of a vaccine versus the real world, that in fact the vaccine is effective. So I think that's my caution. And the other caution is the fact that we're only going to be vaccinating a proportion of our population, one of the more vulnerable groups in our population, and then we'll be phasing it out to other vulnerable groups and then to the general population. And that will take time. And so that is why I'm urging caution that we mustn't become complacent around the fact that we still need all those particular aspects around the non-pharmaceutical interventions. And that will apply worldwide. It's not just for South Africa, but worldwide as well.
When one has to be careful and prepare oneself for vaccination, what should they do? Should they take seriously their immune system? What about somebody who is ill at the moment and has to take the vaccine? What must they do? Should they wait to get well first before they can get a jab?
Yes, so in other words, if a person is experiencing some mild form of illness or fever, for example, a cold and so forth, I think it would be recommended that you delay that in terms of taking the vaccine. And that includes actually becoming infected with the current virus, that in fact you should delay vaccine. So yes, you really are trying to make sure that when you present yourself for the vaccine, that you're psychologically and physically and mentally well, and that you're ready to accept this particular vaccine, that you're armed with all the facts that you need to know about this vaccine, and that you're confident that you want to take on this particular vaccine. Yes.
Well, when somebody has comorbidities, for people who have diabetes and cholesterol and other, chronic diseases, how should they expect this vaccine to be like when they get it?
Yeah, so as far as we know, that you can have mild symptoms and effects, but as far as I'm aware, that those individuals who have the comorbidities will not experience a worse outcome in terms of the actual vaccine, in terms of the side effects, versus individuals that do not have comorbidities. I think what they can expect is that, in fact, if this vaccine works as effectively, that in fact they have a level of protection that they can feel confident about.
Professor,
it's not fully protected, of course,
Professor. Sorry, I think our signal there gave me an impression that you were done talking. My apologies. I just wanted to ask you about comparing a flu vaccine to this one. I'm not sure if I'll be comparing oranges to apples here, but from a layman perspective, when one gets a flu vaccine, there are times when they would catch flu after that, but would get well as time goes on. With this one, because many people don't know about it, what should they expect? Some psychological inclinations about what could go wrong as well must be taken into consideration here as to how does the vaccine work as compared to other vaccines.
Yes, so again, like the flu vaccine, you can expect some localized effect. In fact, as that needle goes in, you can have some responses to that. So it could be slightly painful. You could expect some temperature or chills, for example, some fatigue. So these are similar characteristics to what happens when you have a flu vaccine. But as you know, the flu vaccine does not cause flu. It just causes those particular side effects, and they will resolve. And I think the same will apply to this particular vaccine. You will have some side effects. These should be minor. There should be no major outcomes with regard to this particular vaccine, like anaphylaxis and so forth. So I think it should be relatively straightforward.
All right, thank you very much for making time to speak to us, Professor Adrian Puren, who is the head of department at the Center for HIV and STIs at the National Institute for Communicable Diseases.